Diarrhea is a common condition characterized by loose and watery stools, often occurring more frequently than usual. It's a symptom rather than a disease itself, often indicating an underlying issue within the digestive system. Diarrhea occurs when the intestines are unable to properly absorb water from the food and liquids passing through the digestive tract. This results in an increased volume of water in the stool, leading to its loose and watery consistency. In normal digestion, the small intestine absorbs nutrients and water from ingested food and liquids. The remaining waste then passes into the large intestine, where more water is absorbed, forming solid stools. When this process is disrupted, diarrhea occurs. Diarrhea is incredibly common. In fact, it's one of the most frequently reported illnesses worldwide. Acute diarrhea, which typically lasts a few days to a week, is particularly common, affecting approximately 2 billion people per year, and it usually resolves on its own. However, chronic diarrhea, which lasts for 4 weeks or longer, affects a smaller percentage of the population and often indicates an underlying health problem that needs to be addressed. Causes of diarrhea. The causes of diarrhea are varied and can be classified into these categories: infections, food-related causes, medication-related causes, and other medical conditions. Infections are one of the most common causes of acute diarrhea. These can be bacterial, viral, or parasitic. Bacterial infections leading to diarrhea include bacteria such as Escherichia coli or E. coli, Salmonella, Shigella, and Campylobacter. These bacteria can contaminate food or water, leading to foodborne illnesses. E. coli, for instance, is often associated with undercooked meat or contaminated produce. Salmonella can be found in raw or undercooked eggs, poultry, and unpasteurized dairy products. Viral infections are another common cause of diarrhea, especially in children. Rotavirus is a leading cause of severe diarrhea in young children worldwide, though the introduction of rotavirus vaccines has significantly reduced its incidence in many countries. Norovirus, often associated with outbreaks in confined spaces like cruise ships or nursing homes, is highly contagious and can cause severe, but usually short-lived, episodes of diarrhea. Parasitic infections, while less common in developed countries, can cause significant diarrhea, especially in areas with poor sanitation. Giardia and Cryptosporidium are examples of parasites that can cause diarrhea. Food-related causes of diarrhea include food poisoning and food intolerances. Food poisoning occurs when food contaminated with bacteria, viruses, or toxins is ingested, leading to an acute episode of diarrhea. Food intolerances, such as lactose intolerance, can also cause diarrhea when the digestive system is unable to properly break down certain components of food. For example, people with lactose intolerance lack the enzyme lactase, which is necessary to digest lactose, the sugar found in milk. Consuming dairy products can lead to diarrhea and other digestive symptoms in these individuals. Medications can also cause diarrhea. Antibiotics are well known for causing diarrhea because they can disrupt the balance of bacteria in the gut. This disruption can lead to an overgrowth of harmful bacteria, resulting in diarrhea. Other medications, such as certain antacids, chemotherapy drugs, and medications for managing blood pressure, can also have diarrhea as a side effect. Beyond infections, food, and medications, there are numerous other medical conditions that can cause diarrhea. Irritable bowel syndrome, for example, is a common gastrointestinal disorder that often features chronic diarrhea as one of its symptoms. Inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, is another group of conditions that can cause persistent diarrhea due to inflammation of the digestive tract. Other conditions, such as celiac disease, hyperthyroidism or overactive thyroid, and certain cancers, can also lead to chronic diarrhea. Symptoms of diarrhea. The symptoms of diarrhea are typically easy to recognize. They include the passage of frequent, loose, and watery stools 3 times or more per day. Individuals experiencing diarrhea may need to rush to the bathroom urgently and may pass stools multiple times a day. The consistency of the stool can range from soft and mushy to completely liquid. Accompanying symptoms often include abdominal cramps or pain, which can be mild to severe. These cramps are caused by the intestines contracting more forcefully than usual to expel their contents. Some people may experience bloating or a feeling of fullness in the abdomen. Nausea and vomiting can also occur, especially if the diarrhea is caused by an infection or food poisoning. The process of passing loose stools can also cause discomfort or pain in the anal area, especially if diarrhea persists for several days. The skin around the anus may become irritated, leading to a burning or stinging sensation. Some individuals may experience tenesmus, a painful sensation of needing to pass stool even when the bowels are empty. In more severe cases, diarrhea can lead to dehydration, which brings its own set of symptoms. These can include increased thirst, dry mouth, decreased urine output, and dark-colored urine. In children, signs of dehydration might include a lack of tears when crying, sunken eyes or cheeks, and irritability. Severe dehydration can be life-threatening, especially in young children and the elderly. In cases of bloody diarrhea, also known as dysentery, stools may contain visible blood or mucus. This can indicate a more serious condition, such as a bacterial infection like Shigella or inflammatory bowel disease, and requires prompt medical attention. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of diarrhea. To diagnose diarrhea, your doctor will ask about the onset and duration of your symptoms, any recent travel, dietary habits, medication use, and whether you have been in contact with anyone who has similar symptoms. During the physical examination, your doctor will check for signs of dehydration and may palpate your abdomen to check for tenderness, swelling, or other abnormalities. Stool tests are commonly used to check for infections. A stool sample can be analyzed for the presence of bacteria, viruses, parasites, and blood. Blood tests may also be performed to check for signs of inflammation, infection, and other underlying health conditions. For example, elevated white blood cell counts can indicate an infection, while certain markers can suggest inflammatory bowel disease. In some cases, imaging studies such as X-rays, CT scans, or MRI scans may be needed to get a better look at the digestive tract and identify any structural abnormalities. In cases of chronic diarrhea, a colonoscopy or sigmoidoscopy may be performed to visualize the lining of the colon and potentially take biopsies. These procedures can help diagnose conditions like inflammatory bowel disease or microscopic colitis. Treatment for diarrhea. In many cases of acute diarrhea, particularly those caused by viral infections, the condition is self-limiting and will resolve on its own within a few days. The primary focus of treatment in these cases is preventing dehydration and managing symptoms. Oral rehydration solutions are commonly used to treat dehydration caused by diarrhea. These solutions contain a balanced mix of water, salts, and sugars, which help replenish fluids and electrolytes lost through diarrhea. In more severe cases, intravenous fluids may be necessary to rapidly correct dehydration. Dietary modifications can help manage diarrhea. The brat diet, which consists of bananas, rice, applesauce, and toast, is often recommended as these foods are easy to digest and can help firm up stools. However, it's important to note that this diet alone doesn't provide sufficient nutrients for long-term use. As symptoms improve, a gradual return to a normal, balanced diet is recommended. In cases where a bacterial infection is confirmed or strongly suspected, antibiotics may be prescribed. It's important to note that antibiotics are not effective against viral causes of diarrhea. Viral infections typically resolve on their own, and supportive care, such as rest, fluids, and a bland diet, is usually sufficient. Parasitic infections are treated with antiparasitic medications, which target and eliminate the specific parasite causing the diarrhea. In cases where diarrhea is caused by food intolerances, managing the condition involves avoiding the offending food or ingredient. For example, people with lactose intolerance should avoid dairy products or use lactase supplements to help digest lactose. Those with celiac disease must follow a strict gluten-free diet to prevent symptoms. Probiotic supplements or foods rich in probiotics, such as yogurt with live cultures, can also support digestive health and reduce the duration of diarrhea. Avoiding foods and drinks that can worsen diarrhea, such as fatty foods, dairy products, caffeine, and alcohol, is also important. Now, we want to hear from you. Do you frequently have diarrhea? What usually helps with it? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.